Hello, hello. Hi, everyone. Welcome. So, today I'm going to be having Ava on, and we're going to be chatting about POI, HRT, and mental health. I'm so glad you guys can join us. So, what we're going to be doing with Ava is okay, so Ava is on. I'm going to get her on right now. So, what we're going to do is we're going to talk about POI in order, and then we're going to talk about HRT and mental health and how POI affects mental health and how we manage our mental health. So, let me get Ava on. Hi. So let's see. Okay. So if you guys have any questions at any stage, make sure to just pop your questions and Ava and I will answer any question at any stage. Hi, Ava. Can you hear me? I can't hear you. Can you hear me?
Yes, I can hear you. Sorry about that. I forgot
Okay,
my
that's fine.
headphones. How are you
Hey,
doing?
I'm good. Yourself?
I'm doing good, thank you.
Good, 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 good.
Th-
Good. It's great to like finally have you here. I know we've been chatting a lot offline, so I'm so glad that you're here with us today.
Thank
So
you. I'm so happy to be here. Thanks for inviting me on.
that's no problem. So Ava, we're just gonna jump right into it, okay?
Okay.
So what I want us to do is talk about POI first of all. So if you don't mind just sharing about your POI journey with everyone here today.
Yes, for sure. Okay. Hi, everybody. My name is Ava, Ava Vanderstarren, and I live in Canada. And yeah, I'm going to share some of my POI story. I was diagnosed when I was 17. Started having symptoms a little bit earlier. I stopped my
Network is very bad. Yeah,
and seeing if we could be sent to a specialist. Sorry if it's cutting out there a little bit. Can you see me?
I caught out a little bit there. We
All
lost you
right.
for a few seconds.
Sorry about that.
That's
Yeah, I
fine.
was just saying that when I was diagnosed, I lost my period when I was around 15. It started becoming irregular. It would go on and off, and then I started having long periods of time where I didn't get a period. And so we kept going to the doctor, pushing them to say, something's wrong. And my doctor would say, it's normal for a young woman to have irregular periods, and it will come back. Don't worry. And that happened a couple of times until we pushed to go and see a specialist. And when we did go to a specialist when I was 17, they diagnosed me off of a blood test on the first appointment that I went to. So that was very devastating. To be so young to get the diagnosis. And, at that point, I was still in high school. I was in my last year of school. And yeah, it was a really hard time. It was a really hard time in my life, I have to say. And, since then, over the years, I've gone through a lot of different things. But now I'm 28 years old. I'm on HRT now, which we're going to talk about in a little bit. And, that's kind of like my diagnosis and story.
Yeah,
If you have any questions, let me know, but I can, elaborate on anything. But
yeah,
yeah,
I think
that's,
for me, like you said, I think for me as well, I don't even remember the process of like I remember they did like blood tests and then I was diagnosed. Like let me just share a little bit of my story. I was
yeah.
diagnosed at the age of 19. Like I
Hmm.
had my first period at 15 and then I didn't have a period for almost 4 years. So and I remember being told as well that oh no, it's okay. You can it's okay to have period at a very
Yeah.
late age. It's some people get it at the age of 25. It's fine. So it's nearly like 4 years before I actually went and, seek medical advice. And I remember when I actually got in and went for a blood test, I didn't actually know what was going on. Like during during the time you were being diagnosed, were you being like kind of educated on what was going on, why the blood tests were being done and
I don't know for sure because I don't remember as well, but I know that it was something I'd never heard of before, and it was all very
Yeah,
confusing, and I don't feel like it was explained to me very well, because there's so much information to take in at the time, and there's so much to learn, and I do feel like, it was such a shock. I didn't quite understand what was happening, and also there was a lot of denial too, from myself and from my mom, of course, and people who are close to me in my life. And it was like, no, that can't be, you're so young. Every
yeah,
single person I seem to have talked to, whether they were a doctor or not, was like, you're too young to be going through menopause. That's not possible. It must be something else. So I was kind of in denial for a long time too, and not
yeah,
ready to accept it because then we also tried to go to like a different naturopath, and they said, no, like this can't be happening to you. Try this and this and this. So, for a long time, I think I was in denial about it and not really accepting the diagnosis for a little while. And yeah, I didn't understand everything. I don't feel like maybe everything was explained to me
yeah,
properly. Um, and I just tried to do some of my own research online, but also that's over 10 years ago now. And I felt
yeah,
like there wasn't a lot of resources for women. I definitely didn't have Instagram. And, Instagram is where I connected with you. And I think at that time I had maybe just got Facebook. Like there was not very much happening online to do with
yeah.
this kind of stuff. So yeah, so like I'm really happy I found your page on Instagram this year. And congratulations as well. I see that it's been about a year since you started your
Ah,
page. And it's
yeah.
amazing. I love your page so much. You share such
Thank
good
you.
information. And I
Thank
feel
you.
like now it's a little bit easier to look things up
Yeah, I
online and
agree.
to connect with people on, say, for example, Instagram
I agree.
and even Facebook groups and stuff. And now Zoom, like it's a little bit better easier to find information now. When I was diagnosed, I felt alone for a long
Yeah,
time. I never heard of it before, and I never heard of anyone else who had it. And I didn't meet anybody else who had it for a really
yeah,
long time. Like I didn't even know that there were other ladies who had it. So I felt all alone for a long time with it.
yeah. Me too as well. Like again, 10 years when I first got diagnosed, I was like, what? I didn't really understand what POI was then either.
Hmm.
Although it was called POF, I was like, what is
Same.
that? And I was in denial for a long time. I didn't know anybody else who had the same condition. So there was no one else for me to actually talk to about it. So I felt
Hmm.
really alone for a long time. And it's like you said, there wasn't a lot of social platform then that was talking about POI or anything. So now, like 10 years, a lot has really like changed. So
Hmm.
did you have any symptoms at all during the time? Like do you remember any symptoms that you might have had POI symptoms?
Yeah, but it's funny because when you're going through puberty, people brush off symptoms as like, oh, it's part of going through puberty and those kind of changes. I didn't know that those were symptoms of POI as well, or some of them overlapped. But I do remember having hot flashes, night sweats, and yeah, mood all over the place, highs and
Yeah.
lows. Um, of course, after getting diagnosed, there was like kind of like depression and anxiety that goes along with it, and
Yes.
feeling low, and yeah, feeling alone for a long time. And I'm trying to think of some other ones. Of course, the missed
It's
periods.
hard
Yeah,
because you do actually forget, like it's a long time. You forget a lot of the symptoms that you actually do
yeah.
experience. So it's hard sometimes to kind of remember them. Even
Hmm.
sometimes when I still come across like a page on Instagram that lists like all the symptoms, I'm like, oh wow, so I had that, I had that, I had that, I had that. And you start to
Yeah,
remember, like I remember having that, but you wouldn't have thought it was
yeah,
related to POI at all.
exactly.
So yeah,
Yeah,
some of the
exactly
symptoms
the
I
same
have,
thing. Exactly the same
yeah.
things. Yeah.
Exactly.
Hmm.
And some of the symptoms that I remember, I know there was more symptoms. It's like I actually went through my like old records and I found that like
Hmm.
my like headaches was my number one thing that I complained about to the doctor, and
Hmm.
pelvic pain as well. So I didn't even
Hmm.
remember that I had pelvic pain, but when I went through it, I remember, okay, that was one of the things I did complain about. And
Hmm.
I remember mood swing as well. That was like a major thing for me, mood swing and
Yeah.
just being all over the place, not understanding what was going on. with me. And I
Mm-hmm.
think over as the year progressed, there were more symptoms like vaginal dryness and things like that that came along with
Yeah.
it. So yeah.
Yeah, me
So
too. I
then
feel like that too. Like at the beginning, it was like a little bit, but then I was
yeah,
put on hormone medications like pretty quickly off the bat. So it started to get a little better, but then I would still have things. But
yeah,
yeah, definitely as it progressed to the point of like instead of like just the early days of it, like into full blown menopause or POF, as they said, yeah, like I had all of those symptoms too. And like you, I can look at a list of symptoms and see all of the same, and be like, yeah, I had that, I had that. And like, yeah, like having a regular period and then no period for a really long time was one of the main
yes,
ones. Like that was the one that was the most concerning of like, why do we need to go to the doctor? Like, what's going on? And everything else was kind of brushed off as like, oh, you're a teenager. All teenagers have like mood swings or, irritability or fatigue. Like, and like now, yeah, I have fatigue or joint pain, muscle pain, or like problems sleeping, or go through different periods of stuff like that. And then, yeah, like there's the problems that you mentioned too, like sexual problems, libido,
yeah,
low libido.
exactly.
Yeah, yeah.
I actually made a list. I'm sure you made your own list as well.
Yeah,
I actually made
yeah.
some lists because it's easy to forget things, especially with that brain fog. It's easy to
Hmm.
forget. So it's better to actually make a list and go through them. So for me,
Yeah,
it was like no period for nearly 4 years, like hot flashes, night sweats, anxiety. Like I used to have bad anxiety, mood swing, brain fog. Even people that know me remember from a very young age, I was very forgetful. And they used to wonder, Anita, why are you so forgetful? What's wrong with you? Like I
yeah.
had no idea that it was actually associated. And one thing I
Hmm.
actually found out recently, the list that you shared in regards to PY symptoms, I saw something about feeling dizzy and fainting. So,
Yes.
and that brought me back to when I was younger. I used to faint a lot when I was younger, and I would end up in the hospital with drip. I didn't like actually seeing that. I was like, maybe that could have been an earlier sign.
Yeah,
And
maybe.
so that was quite surprised when I saw that on the list because that's not something I actually knew was part of fainting. I know dizziness was part of it, but fainting, I didn't think that was actually part of the list as well too. So
Yeah.
I was surprised to see that. And vaginal dryness, difficulty sleeping, pelvic pain, like I said already, and just lack of concentration. It's like I still
Hmm.
suffer majorly with poor lack of concentration. So
Hmm.
those are some of the symptoms. Like we it sounds like that we both
Yeah.
have like similar symptoms as well too.
Yeah.
So it's
Yeah.
yeah,
Same. Sorry, I didn't mean to cut you off, but yeah, the
it's okay.
same,
Don't worry.
like I have the same ones too,
Yeah,
and like, yeah, like some of them come or go, or some of them you almost get used to them, which is kind of weird, but like it just becomes your normal for
yeah,
you. But yeah, sometimes they're more intense than others. But yeah, I have also fainted a few times, or I do get dizzy sometimes,
yeah.
and like you just, when that happens, you're like, oh my goodness, what's wrong with me? What's going on? But yeah, also heart palpitations. I did have some heart
Yes.
palpitations too. I remember going to get my heart checked, wearing a Holter monitor to monitor my
Wow.
heart, and going for a stress test on they hook you to the machine, and then you do some running on the treadmill. And yeah, I remember like doing all of that stuff too. Like I have that too. So yeah,
It's crazy. It's not easy. Okay,
I
so
know.
what we're gonna move on tonight is talk about like the HRT, the first time you got on HRT and
Sure.
what HRT you're taking, and we'll move on
Yeah.
from there. Let's see if there's
Yeah,
any
yeah, I just
questions.
wanted to say hi to a few people. I saw Lori. Hi, Lori. How are you? And a Sierra Leone one-to-one joined. Hi, guys. We're talking about premature ovarian insufficiency. Sharing our stories is something that both Anita and I were diagnosed with over 10 years ago. And in Anita's amazing page, The Blossom Living with POI.
Thank you.
Oh, I see Life of POI is watching. Hi.
Yes. Oh, is that okay? Let's see.
And someone named Lucy, and I see a few other people. So, hi
Yeah,
everyone.
thank you guys so much for watching. Really appreciate it. Okay, so HRT, let's get down to hormone replacement therapy.
Yeah. So, it's also another confusing thing when you're first diagnosed, especially because you're like, do I start taking hormones? Like, I don't understand what's going on. For me, I was on a bunch of different ones over the years. I got started
Yeah.
off right away when I first got diagnosed, I got started off with prometrium, which is a progestin pill, and
Yeah.
estrogel that I rubbed on. And then over the years, I switched a lot. I've switched a lot of different times, and I got put on birth control pill for a long time too. So yeah, and then
I
now I'm
think we
back.
actually talked
We're
about
going to talk
that. Sorry,
about
yeah, we
that.
talked about
Yeah.
that. Yeah. Eva told me that she was on birth control for a while. I was like, birth control, like, were you on H? That's one of the things I've noticed. Like, why would you give birth control and you don't give like HRT treatment right away and you just remain
Hmm.
on birth control because birth control is not an HRT treatment,
Hmm.
and I've also heard in some cases they say if you're on HRT is not, it does not prevent pregnancy just in case. You
Right.
have to be sure you take birth control. It should also be the same way the other round when you're on birth control, make sure you're also on HRT treatment. So yeah.
Yeah, I know. And for anybody who doesn't know, HRT stands for hormone replacement therapy.
Yeah.
And yeah, because our hormones are lacking, we don't have our body's not producing them ourselves.
Enough
And yeah, and
estrogen. Yeah.
estrogen, progesterone, and so yeah, like I think a lot of doctors just didn't know. Like if they're not specialized in that area, they just won't don't know. And I
Yeah.
think my doctor was like, "Well, you want birth control option because you're." I was young, and I was like, "Well, I have this going on. I'm not ready to start a family. Like, what if I did end up getting pregnant or something? Like so." I wasn't ready to have a baby in my early 20s. So I ended up saying, I also need birth control options. And so then my doctors would just be like, well, why don't you just go on the pill, like go on birth control pill? That's going to be birth control and your hormones. And I was like, okay, and that got recommended to me by a couple doctors. And so that's what I did for many years, and I went on a couple different brands. I think over the last, like there was maybe a 5-6 year span when I was on it, and I probably was like on maybe 3 or 4 different brands. And then I stopped taking it when I was on Yaz for the last little bit, and I ended up having a blood clot scare. So some people, Yaz causes blood clots, and it did for me. I remember I had like an anxiety attack at work, and I was feeling really sick, and
Oh,
something was wrong with my body. And
yeah.
that day was really scary because like I had felt some weird things happening in my body. Something wasn't right, and my legs had some bruising on them, and I was like, what's going on? And and then at work, I went to work, I was feeling sick, I was feeling gross, and I had like an anxiety attack at work. So I ended up going to the hospital. I went to the emergency. They said, you know what, I think it's best if they took me with a car to the hospital. And I got checked. And luckily, like I stopped taking it that day and I didn't take it anymore. But it was caught early. I didn't end up having a formed blood clot, but my blood was starting to clot more. And I remember when I had withdrawing bleeds on that too, it was really
Yeah.
bad. It was really clotty too. So that one was not good for me. And so I stopped because then I got scared. I was like, I don't want to get blood clots from this.
Yeah.
And then that was really awful for me too because I didn't have another prescription. So I remember when I went off of it, then I got full blown, all the menopause symptoms came back.
Well,
All the
yeah.
symptoms on the list came back like with full force, like really intense. And it took me a while before I got an appointment in to see my doctor who specializes in women's health and POI stuff. I think she sees a lot of patients who have POI, and finally got onto the hormone replacement therapy again,
So
which I've been on since then. So that was really scary, and it was
that
just,
is scary. And like during the time you were on the birth control, like were you not getting the um POI symptoms during that time on the birth control?
um, just like a little bit,
A little
just
bit.
like,
Okay.
how it is kind of now, I think. Like it
Yeah.
helped to manage the symptoms a bit, like, but it wasn't, it wasn't perfect. You have like any kind of hormones that you're taking, I think it messes around with your system a little bit, right? So I was still getting some symptoms, but I was just like, this is all I knew. Like I was my normal. Like I didn't know that there was, anything else going on. And I
Anything
felt,
else? Yeah.
yeah, and I was following the advice of my doctors to get that birth control pill. And so that was, yeah, it was really scary. And then since then, what I'm on right now is I got an IUD, the Mirena intrauterine device That is what I have right now, which is supposed to give me some progesterone. Um,
Yeah.
and then and then I take estrogel, which is an estradiol rub-on gel, which is supposed to be bioidentical HRT. That's what I'm on
Okay.
now. Yeah.
Perfect. And how's that going for you?
I think it's good. Like I liked it. I think it was really good for me for a while. Of course, when I first got the IUD, I had a lot of bleeding and a lot of spotting. So it took my body a while to get used to it. There was a couple of months where I was bleeding and spotting like almost every day, or then it would go away for like a week or two, and then I would have bleeding and spotting again. But once my body got used to the IUD, it took about maybe 4 months and then it completely went away. So now, since then, the last year to 2 years, I haven't had any spotting, no period, nothing, like nothing like that. And then the estrogel, like, yes, I do have to rub it on my skin every day. So it is, it can be annoying to be like, oh my gosh, it's that time. I need to find a bathroom. I need to go get my medication and put it on. But it's
Yeah.
really important. And I think that does help me a lot. If I didn't have it, all my symptoms would be way worse. It's not
Yeah.
nothing, it's not perfect, but it's something that's helping me a lot. And I think
Yeah. It
it's really
helps.
important.
Yeah.
Yeah, it's really important for bone health and heart health and to have the estrogen in your body. And yeah. And how about you, Anita? And I also see a comment
I
here.
think there's a question. Yeah, I'm on. What's that? Okay, that's good.
Yeah. I
Nitrogen
haven't
and
heard
gel. Yeah.
estrogel. Yeah. Yeah.
I think what I've noticed that a lot of people seems there are a lot of people are on the estrogel, so that's kind of something I'm trying to explore because I'm trying to explore more at the moment. I'm trying to explore like more alternative HRT treatments because for a
Mm-hmm.
long time I was initially on the Avon patch. So I started with the Avon patch right away as soon as I was diagnosed. And
Mm-hmm.
I was on that for like if I think it was 2 or 3 years, but the side effect from that was just too much for me. Like my breast was so tender, like I
Okay.
couldn't lie in my bed, I couldn't do anything much with. So I went back in and they prescribed the Femistone counting one by
Okay.
five, which was a lower dose. So I was on the Femisto County 1 by 5 for 8 years. And then
Okay.
I noticed that some of my menopausal symptoms were coming back. So at that time, I really had no one to talk to about it or to even like express my concern on what needs to be done. So I was really alone for a long time because so what I did then is I did my own research online to see, okay, what is the higher dose of Femisto?
Right.
Femisto 2 by 10. Then I came across the Femisto 2 by 10. It wasn't counting. So it was
Mm-hmm.
broken down into progesterone for, I think it was 12 days or 14 days, and estrogen for 12 or 14 days. I was on
Okay.
that for 9 months. And that was
Yeah.
the first time actually in years that I had like a monthly withdrawal bleeding because it was broken into two. It's meant to
Mm-hmm.
induce withdrawal bleeding.
Mm-hmm.
So initially, when I started getting my period during like on a monthly basis, I was like, "Oh wow, I'm getting period. That
Yeah.
means things are getting better." But I didn't realize, oh no, it's just
I
it's
know.
just the HRT doing its thing. So I
Yeah.
had to stop the Femestotune by 10 because I know some things were just some side effects. I wasn't sure if it was related to
Yeah.
the HRT, but again, there was no one to actually talk to. I was doing a lot of research myself, finding out a lot of information myself. So
Yeah.
I made the conscious decision to go back on the Femistone counting 1 by 5. So that I've been on that now for the past few months. So it's been a roller coaster. So I'm trying to
Yeah.
now hopefully see somebody soon. So I'm trying to explore other HRT treatment in terms of that. I've
Yeah.
heard good things about the institute gel. So I'm trying to
Yeah.
explore and see if the gel could be something I could
Yeah.
try. I'm trying to just,
Mm-hmm.
yeah.
And I
So
think everybody's different, right?
yeah,
And I think it's really important to keep exploring until you find one that works for you because, if it's not working well, you got to keep trying until you get one that works. And I remember having to
exactly.
try so many different things, but when you find the one that works, it does help with the quality of life a lot, right? And I think that the estrogel for me gives me, like when I was taking it, we tested my estrogen when I first went back on it again to see what my level was at. And I think
Yeah.
it was a little bit higher, like I had a lot more estrogen, so it helped me feel a lot better. You know, like it was in like 200 to 300 range. I don't know if you have the same kind of testing, but
Yes, me too.
yeah, yeah. So you know, I think that was helping me a lot with some of my symptoms. But lately, I've been starting to feel like more of my symptoms have been coming up, and I don't know if it's just from POI stuff or if it's because of stress or extra fatigue or what's happening. So I'm trying to get down to the bottom of it. And basically, like the last 6 months, there's been something I've been feeling is not quite right. And I'm trying to get into my doctor. I'm on a waiting list right now. So hopefully, I'll get in to see her pretty soon and just make sure everything's going okay.
Yeah, the same thing here. Like last summer, what I did is I went to my GP and I requested some blood tests, like for everything that was going on. So we did some blood tests on HRT, and
Mm-hmm.
when the result came back, my estrogen was like around 200. So,
Mm-hmm.
which I heard that it's really good because around like 200, that's actually very good. So, since I went back on the Femiston County 1 by 5, I don't really know what the level is right now. So, the next thing is to
Mm-hmm.
go in and hopefully get some blood work and see, like just like
Okay.
yourself, I have been feeling slightly off for the past few
Yeah.
months in terms of
Okay.
feeling very fatigued, back pain and migraine and things like that. So, but
Yeah.
again, this is the other thing as well. It's so hard because I also do suffer from thyroid and they have like similar symptoms.
Right.
So it's so hard sometimes to kind of identify them. But it's like I always say, it's worth a try doing a blood test for both of them just to, see
Yeah.
what's
I
going on.
hope I hope
Yeah.
everything is okay with your thyroid because it's just hard when you have so many different things going on, you know? It's hard.
It's not easy. But anyway,
Yeah.
I think with a thyroid, for anyone, if you have a thyroid on top of POI, it just makes things just extra kind of difficult because it's just if you're tired, you're extra tired. When you have a headache, you have like it's as if your head is just pounding.
Hmm.
It's crazy. But anyway, I'm gonna
We
keep
have a
going.
question. We have a question here.
Sure.
Someone said hello, Ramata Kane. Hi. And Rachel said, does your doctor make you stop all HRT for 6 months every time you change HRT? For me, it's no. For me, I don't, because if I was to stop, I would, like, all my symptoms would come back, and not having estrogen for that long, I don't think is good for your bones. Correct me if I'm wrong,
The
Anita.
same for me. I didn't have to stop. I had to go right on the next HRT because if I stop it for that long, again, all my symptoms would just come back. You need to, because I'm on the continuous HRT, so I have
Hmm.
to always be on my HRT
Yeah.
treatment. So it's no, not for me personally, no. But
Me too.
why would they advise you to do that? Would they give you a specific reason to why though?
Yeah, Rachel, if you're still on
Rachel,
and you're
yeah,
hearing, feel free to type back because, yeah, also like the things that we're talking about with HRT, why it's important is like the bone health. I've heard of women sharing their stories where they didn't go on HRT and now they're dealing with osteopenia or osteoporosis and stuff like that. So, and also, of course, supplementing with calcium and vitamin
yeah,
D, and that is so important. But in order for that to be helpful to your bones, you have to have estrogen in your system, right? And if you
yeah.
don't,
Yeah, and I think like maybe it's more education is needed on why you need to take HRT. I feel like when you're being told that you need to take HRT, it's more like they tell you HRT help relieves menopausal symptoms, but they
mm-hmm,
don't actually tell you that the estrogen is so important. Like that estrogen is what you need. It's so important because, like you said, it
mm-hmm,
looks after your bones, your brain, your heart, your muscles, and everything. Like even with the
yeah, everything,
vaginas, yeah, it looks
mm-hmm,
at everything. I think that needs to be what is highlighted that you're
yeah,
lacking estrogen. So you need estrogen to help with everything in your body, your productive system. So that's
uh-huh,
why it's important to be on HRT treatment. Because a
yeah,
lot of the time, like you said, people don't go on it because they're like, oh, I don't need to be on it. And whatever works for you. But at the end of the day, when they come back and go on
mm-hmm,
HRT because of their health issues, because of their bones
mm-hmm,
and everything, I think that needs to be put across and highlighted that it's important
yeah,
to, yeah.
yeah, and I think it's important to go for a bone density scan if you can,
Yeah,
at least once after you've been diagnosed to see where your level's at, and then you can check your bone density again. Because nobody wants to be in their 20s or 30s and dealing with osteoporosis. And that has happened to some ladies. And the thing is, I remember also hearing recently too that people saying that the hormones were not good for women, but those were studies that were maybe done with women who were in their 50s and 60s, you know. But for us at our age, we need that. It's for
Yes.
overall health. It's not that we're adding hormones on. It's because like when you get older and you go through menopause naturally, your hormones naturally go away, and
Yeah.
then you go through menopause in that cycle. But when you have it at a young age, you still need that through your whole life for your quality of life, because otherwise your life expectancy can go down. Like your
Very slow.
quality of life is diminished a lot. So it's really important to have the hormone replacement therapy there, because it is replacing the hormones that we should have at our age,
Yes.
right?
And I
So
think, yeah, just to add to that as well, I think also when it comes to progesterone as well, it's with women that have uterus that I hear that it's very important to actually, make sure you're on progesterone because it protects the lining of your womb. And I noticed
mhm,
that a lot of women are not on it. They say, "Oh no, I'm not on progesterone." I'm like, "Could
mhm.
you still have a uterus?" Like, yeah, but that's just to me I can be on estrogen. That's fine. It's also
Mm-hmm.
important to be on progesterone because estrogen and progesterone are equally important for your overall health.
Yeah.
Rachel said, my doctor never told me why. I changed HRT 3 times and he made me stop everything. Okay, that's
Okay.
you should definitely. If I was you, I would like. Is there a reason? Like, if someone asks, like, if my doctor wants me to do this or do that, what I do now is I actually ask, what is the
Mm-hmm.
reason for that? So I would definitely go back and ask, what is the reason for stopping the HRT? Is there a
Mm-hmm.
reason for it? So just to get your answer to that,
Mm-hmm.
because
Mm-hmm.
that's a bit strange to be asking you to stop it.
Yeah, I know.
Yeah,
I don't want to give any medical advice either. Like, definitely ask your doctor,
yeah,
but I think it's
absolutely.
very important because also, like, for me personally, if I was to stop it for that long of time, my hormone roller coaster ride would be so intense, and I
Yeah,
think it would actually be worse for me in the long run.
yeah, and it's like
Yeah, and every
starting
time
over
I stop, the
again.
menopause symptoms get
Yeah,
worse, is what she wrote down. And
yeah.
hi Danielle, thanks for
Oh, hi,
joining. My
Danielle.
friend
And
Danielle's
then,
on.
oh, hi. Thank you so much for joining us. Every time I stop, the menopause symptoms get exactly. And I think it's like starting over again. Like if you stop it for 3 months and then you start HRT again, you're gonna go through all like the side effect again, withdraw bleeding for a certain amount of time. So it's like starting all over again. So I would definitely, my best advice, like Eva said, is to ask the reason why and see
Hmm.
what the doctor has to say. Yeah.
Hmm. And maybe
Eva,
get another opinion too. Like if you have
yeah,
another doctor you can ask as well that knows things about females' hormones and this type of thing, just to getting
yeah,
another opinion if possible, right?
yeah,
If you're
definitely.
not feeling right about it. Yeah.
Perfect. Eva, what were some of your side effects from your HRT? Like, what's kind
Like you mean like I think I have positive side effects from it, but I'm not sure.
of, let's
Like
hear that.
I think my positive side effects from it is reducing a lot of the menopausal symptoms,
Yeah,
like the things that are really, really disruptive.
of course.
And then, yeah, what we were just talking about, bone health, heart health, overall health, mental health, I think it helps with everything.
Yeah,
So I think for me, it's really important to be on something, because
yes.
if I don't, like, I'm pretty far into this condition. So if I go off of HRT, it's full menopause. It's not like perimenopause or anything like that. Like I've had this since I was 17, over 10 years now. So for me, if I go off of hormone replacement therapy, it's really, really bad for my body. It's going through like a lot, right? So I don't know about negative side effects, except for what I was explaining when I first got the IUD, of all of the with like all of the spotting and the bleeding that I was having, which seemed to have now gone away. So I don't know if that was just my body getting used to it. So I think that was my major one. It was with the IUD for the progesterone, was just my body getting used to the IUD and the spotting and bleeding for such a long time. And then I don't know if I have any negative side effects from my estrogen or from my IUD, because um, if it's a side effect, it's either, is it from that medication or is it my POI symptoms that I have, like
I
with the
know.
mood swings, with or depression or
Yes.
anxiety or joint pain or headaches or fatigue or memory problems, like all those
Yeah.
things we were just talking about. Like I don't know, is that just my POI and it's my or is that a side effect of the
Yeah, I
medication?
think
I
like
don't
we spoke about that earlier. I actually told you, I was like, if you actually think deep about it, like some of this like side effects of POI, once you're on HRT, like it's supposed to like relieve the symptoms and it's estrogens provided for you. You notice that you are actually still getting some of the symptoms, but then are they side effects or they're still like POI symptoms? Like for example, you still get like mood swings, and mood swing
know.
is part of symptoms of POI. One of the things I said, mood swing, vaginal dryness is still there. So
Hmm.
sometimes you think, then do I need a higher dose of
Yeah.
HRT then to help with the vaginal dryness, even though your estrogen level is around like 200, it's pretty much good. You're still
Yeah.
suffering with like vaginal dryness, so you start to
Still,
wonder as
so
well. And there's
yeah.
still a lot of things. Yeah, go
Yeah,
ahead.
go ahead. No,
Go ahead.
I was just going to say that too,
Yeah,
like, and I don't know if that's just something we have to deal with forever or if
it
there's,
is.
things, but just finding the right kinds of lubricants and making sure
Yeah.
that you're taking care of yourself properly is really important. And I
Mhm.
know it's a topic that's hard to talk about because some people get very embarrassed and stuff, but like, there is also estrogen that you can put inside of your vagina. I don't know
I think it's
if
called
you've ever
what's it called? I can't remember
Vagifem
now. But
or
yeah, that is Vagifem. I think it's
there's a
Vagifem.
few different brands, but
Yeah,
yeah,
yeah.
yeah, yeah.
So for me, some of the side effects, I had like positive and negative as well, just like you. Of course, the positive is helping with your bones, just like you said. For me, I don't know if you ever got like tender breast. For me, tender breast was like really, really bad. Like my breast is always tender. And recently, when I went to the hospital because I had some physical exam a few months ago, and they told me that like there was like the lump on my breast was not consistent with the rest of them. I got really scared at that point. I was like, what is going on? So I went into the main
Yeah,
hospital
that's
and they did
scary.
yeah, I was scared. So they told me that there was a name for it. I can't remember. I put it here actually. And they told me that I have that not to worry about it. It's just breast. What was it again? Did I write it down? I think I thought I wrote it down, but I can't remember, guys. Sorry. I'll leave it in the comment that not to worry,
Oh,
that it's
like
just
the tissue, breast tissue.
yes, a breast tissue, but there is a name for it. It's a breast. He said that it was the breast tissue, and it's just that there's more on the right hand side than the left hand side. That's why
Mm-hmm.
it's a bit more tender, and it's like inflammation from. So that's when I told him, I'm on HRT. He was like, "Oh, you're on HRT." He's like, "Yeah,
Mm-hmm.
that's the reason why, because
Okay.
you're helping me with it." So I was like, "Okay." So
Yeah.
at that
And
stage, I was like, "That's good to go ahead."
did you have a mammogram?
I did. No, I didn't have a mammogram. I had an ultrasound. So, but the doctor recommended for me to have my first mammogram at 40.
Okay.
So at 40, I'll be having the first mammogram. But for now,
Mm-hmm.
everything is fine. So I was very happy to hear that.
That's good. Yeah.
Yeah. I had so in terms of then, I think that covers like. Is there anything else you want to add to HRT?
Yeah. Did you have any other negative symptoms or positive symptoms you want to say?
In terms of negative, I think just bloating. I had a lot of bloating. I noticed that my stomach region was getting bigger, like
Okay.
was actually getting bigger. Initially, I didn't know why, but I know that bloating is a side effect. And also back pain. I still do get back pain, but again, that's the other thing we were saying.
Me too.
Is
Yeah.
that POI or is that side effect from HRT? It's hard to
Right.
tell because when you actually do look at the leaflet or you search online HRT side effect, back pain is part of it, but that's also a symptoms of POI. So it's sometimes just
It's so hard to tell.
it's
Yeah.
yeah, it is. And mood swing is something I still deal with a lot.
Mm-hmm.
Leg
Mm-hmm.
cramp. I do get leg cramps
Mm-hmm.
for me. Irritation. Sometimes I just get really irritated.
Yeah.
It's true. Sometimes I find myself getting very irritated. I'm like, what's going on? And I realize, okay, yeah, it's okay. I need to take it easy on yourself.
I
I
know, I know. There's so many things that can go along with it. And I'm just looking through
know.
my list of symptoms too. And yeah, I think memory problems as well. Like, I think, sometimes people have commented, oh my goodness, like you can't remember that. But there'll be things,
Yeah.
some things like events, like sometimes I can remember some details, but sometimes there's things where I completely forget that they even
Mm,
happened.
yeah.
Like there's some gaps there sometimes, which can be really scary.
It's and
Uh,
one other major thing I realized is when I initially went on the Featherstone County 1 by 5, I noticed I had a lot of like itchiness and soreness around my vulval area. I've
Okay.
learned that it's not I used to call it vagina, but I've learned that it's vulval, not vagina.
Yeah. Yeah.
So I had a lot of like itchiness and soreness around there where I noticed that my skin was actually like peeling. So that
Oh,
was
sorry
actually
to hear
one thing
that.
I went to, yeah, that was one thing I went to the doctor and he said, yeah, that could be also be side effects from HRT, especially if you're starting for the first time.
Yeah.
So but it's much, much better now. But that was something I noticed that I did experience. I just wanted to share that because a lot of people do experience that as well too. And
Mm-hmm.
I think
Mm-hmm.
what else? Constipation. I don't know if that's something you ever experienced.
Okay.
Uh,
I don't
yeah.
know because like I had digestive problems on the list as a symptom of POI, but then I sometimes
Mm,
I don't know, is it my diet and what I'm eating, or is it have to do with
yeah.
POI, or does it have to do with medication side effects? I don't know.
Constipation.
Yeah.
That's the thing. I-
Mm-hmm.
It's it's hard to tell sometimes because sometimes you feel like you're eating right, but you still
Mm-hmm.
have constipation and you wonder why it's
Mm-hmm.
that happening. But I've noticed that sometimes it could be with the HRT as well too.
Mm-hmm.
And I think that's pretty much. I don't have anything else. That's a couple of things that I have down
Okay.
here.
Yeah.
Yeah,
And that's the thing too. It's so hard to, like we've been saying, about knowing whether it's a POI symptom or a side effect of the medication. But I still personally feel for myself that the HRT benefit outweighs any side effect that I'm receiving at the moment. Like that can change because your body's always changing, but like even though it can be difficult to be taking hormones, I think it is really, really important for your overall health. And
it
that's
is.
what I've been feeling for myself. So I know like it can be overwhelming to think about going on different hormone medications and stuff. But if you find the right one that works for you, it can make a world of difference with your quality of life.
I agree 100%. I feel like even now when I ask myself, I can't imagine not being on HRT because I've been on
Mm-hmm.
it for such a long time. So
Mm-hmm.
I will definitely that's something I will definitely not be like giving up anytime soon because I know
Yeah.
how beneficial it is to my health. So yeah,
Yeah.
definitely.
Yeah.
Um, so when we talk about, let's talk about mental health then.
Okay. Sounds good.